For the recording's benefit, again, my name is Devin Hogan. We have Paula Schmidt and Becky Stoddard with SSG, and we will be presenting today's random moment time study and reimbursement session. Today, we're going to cover the basics, participation requirements, you as the LEA's participation requirements, how your cost pools impact reimbursement, how accurate responses lead to accurate and appropriate reimbursement, and how using your cost pool lists can lead to your advantage. And starting us off today will be Paula Schmidt.
Okay, good morning, everyone. Okay, starting with the basics. The random moment time study is just that. It's a random generation of randomly selected number of participants statewide. For this reason, staff may receive no moments or they may receive several moments during the quarter. Each moment, remember, represents a minute or a moment in time, 60 seconds. The RMTS is conducted quarterly and affects both the quarterly and annual reimbursements. The time study is a federally approved method for determining how much time is spent on MA-allowable activities. Results must be statistically valid and are used for federal reimbursement. Oh, thank you so much. So let's talk about what data points affect sample validity. 3 important data points that affect your sample's validity are calendars, work schedules, and of course, your staff pool lists or cost pool lists, which will kind of use staff and cost pool interchangeably. More of your coordinators might refer to it as a staff pool list, where your finance folks may refer to it more as a cost pool list when they are doing the quarterly max. So kind of interchangeable. Calendars define your non-working days, ensuring that the study is conducted only on those school days that staff are working. This is crucial for compliance. Calendars help ensure that moments are spread out evenly over the entire sampling period. Ensuring moments are not generated on those non-work days minimizes invalid moments. Participants, specifically the employees and contractors, should be selected for moments at times when they are working. This is accomplished by associating participants with accurate work schedules. Work schedules should be customized for part-time employees and variable schedules. You should only include the time that employees and contractors are working in their primary role. You should not include any extended hours, such as time worked in extracurriculars or maybe club lead. Those types of roles are not allowable. The 2 staff pools, both your administrative pool and your direct service pool, are required for each time study. Staff pool lists define eligible staff and balance your sample. A balanced sample ensures that representation is made across all job functions and service areas. Cost pool lists help identify non-eligible staff as well for exclusion and improve the accuracy of your cost allocation. Sample validity and higher reimbursement. This is achieved by integrating accurate and detailed calendars, work schedules, and cost pool lists information into the RMTS sample generation process. Doing this, the system can produce random moments that are more accurate, representative, and valid. This ultimately leads to more reliable data, a higher RMTS percentage, and potentially greater Medicaid reimbursements for all LEAs. As you know that all LEAs do share a common RMTS percentage. I'm going to turn it over to Devin for our next session, which we're going to talk about participation requirements.
Right, but it's. Okay. We are having some technical difficulties with the recording, but I will jump in with the RMTS participation requirements. Oh, we are having trouble with the slideshow as well. Thank you everyone for your patience. Is this working? Ah. Okay. So it is a requirement to participate in the random moment time study. It's a piece of your participation in the program. In order to receive reimbursement, you have to do this. It's a quarterly run study, as Paula let us know. So any quarter that your LEA fails to participate can affect your reimbursement for that quarter. You need to certify this information. You need to participate in the study, and you need to monitor your participation. So you need to make sure that your response rates are appropriate. You need to make at least 85%, but we hope that you strive for 100% response rates. And DHS can let you know, reach out and ask for corrective action if we notice that you are not keeping up your response rates. I'm working on that right now. So if you get one of these letters, don't panic. We can look at strategies to get those response rates back up, but that does need to be done in order for you to participate in the program and get reimbursement for these services. Next slide. So I know that a lot of people are concerned about this 2-day response window. Right now, this is a recommendation. In the future, this will be a requirement. But right now, the requirement is 5-day response window recommended within 2 days. This helps the validity of the data that we're collecting. This is something that CMS is pushing for, and again, it's going to be required. So I recommend that you start this process now. You must also maintain proper documentation of your cost pool lists and anything that you think might support what you've submitted in the time study. You are required to comply with state guidelines, including anything that we send out to you about the random moment time study. Please feel free to reach out with questions, but pretty much our word is law. So, next slide. Oh, that's it. So Paula, back to you.
Thanks, Deb. Okay, so we're going to talk about RMTS and how cost pools determine costs. The RMTS cost pools determine costs or reported costs for annual cost settlement and the quarterly MAC. Annual cost settlement direct service cost pool lists determine the providers who may bill for service payments, or as we refer to them, your interim payments. LEAs can only report costs for those direct service staff on their direct service cost pool at cost settlement. So it's important that they are on accurate participants are on your RMTS staff pool list. It all starts with accurate RMTS lists, and those flow over when you report your quarterly MAC costs, and they also flow into your cost settlement. If they're not on the RMTS list and they don't flow over, you cannot report costs for them later. So again, LEAs can only report costs for those direct service staff on their direct service staff cost pool list. And credentialed providers, remember, those folks on your direct service staff pool must be properly credentialed. These credentials are outlined throughout Section 3 of the SBAP handbook. And a list of those direct service job types can also be found in the handbook in Section 8.4. For quarterly MAC claiming, both cost and staff pools are represented, and costs for staff for both direct and, okay, let me start again. For MAC claiming, you have both staff pools that need to be represented, both your administrative staff and your direct service staff. You're going to report those reportable costs. So also in your handbook is a list of allowable cost pool job types, and you're going to find them in section 8.4, A and B. So who can and can't report costs or have costs reported for them, both quarterly and annually, begins with accurate RMTS staff pool lists for both your direct service and your administrative pools. The participant information, these are participants that you should be reviewing quarterly for accuracy and making sure that those cost pools are accurate and reflect what is actually going on in your district at that time. Next slide. You're there already? Thank you. So in calculating costs for the direct service pool, the Medicaid eligible percentage derived from the RMTS is multiplied by the total allowable direct service costs to determine the claimable amount. Likewise, for the administrative service pool, RMTS results help in determining the claimable proportion of administrative costs that support Medicaid services in your district. During the cost report submission, the calculated MA allowable costs based on the RMTS derived percentages are then used to ultimately determine quarterly MAC reimbursement and the annual cost settlement through the school-based access program. And I'm going to turn it over to Becky to talk about accurate responses and how they lead to appropriate reimbursement.
Okay. How do the RMTS responses impact the percentages? Each moment is categorized based on the type of activity that's being performed at the time of the moment. So that's the one thing you have to make sure that you stress to your participants is we just want to know what they're doing at that one moment in time, not what their whole job title is. Well, not what all their job duties is, but just what they're doing at that one moment. That helps us to do the coding appropriately. Once we get that actual information, we are able then to calculate the direct medical percentages. For the annual cost settlement, the direct medical percentages is what is used in the calculation of your cost settlement. The Medicaid, the MAC claiming, we use the RMTS percentages from both of the cost pools. So for cost settlement, we only use the direct service. For the MAC, we use both of the cost pools. When you are setting up your staff pool list at the beginning of the quarter, you have to consider what your staff people are doing. You have to look at what their job title is, their job responsibilities are when you're certifying your cost pool list. If they do not support a direct medical activity or administrative activities for the SBAP at least some part of their time, you're hurting your reimbursement if you put them on there. Plain speaking, if you list all of your teachers on there and all those teachers are standing there teaching, you're not going to get a reimbursable moment. So they're hurting the whole state because it is a statewide percentage that we do. So think about that when you're putting your people in your staff pool. Your RMTS, your responses are coded based on the details that the respondent provides. These percentages are calculated to determine the proportion of time that they're spent doing a Medicaid activity. Training your staff will give us more accurate responses. So once a year at least, you need to be doing a training with all of your staff members. One, to introduce them to what the RMTS is, because we get a lot of emails that come in. I got this email. What am I supposed to do with it? That's because the district didn't share with them that, one, they were a part of the RMTS, and two, they never explained to them what they were supposed to do. So make sure you're training on a regular basis. That's going to increase the probability of getting a moment that is reimbursable. You have to continually monitor. As we stated, right now you have a 5-day response window before the moment dies. Once that moment dies, nobody can respond to it. It's lost and it counts against you. But it is probable and that it's going to go to a 2-day response. So we want you to think about moving to 2 days now. Encourage your staff members to respond within their 48 hours. That way they'll be more used to it when it becomes the actual mandated requirement that they have to do. As you can see on this slide, when your respondent doesn't respond appropriately, or they don't answer our follow-up questions, and we have to mark it as a non-billable moment, that drives the RMTS percentages down. But if you have properly trained your people and they respond as soon as they're supposed to, they give us clear and concise responses and we can code it appropriately, that's going to bring the RMTS moments up across the state, not just for your area, but for everybody. Because unfortunately, with a statewide time study, what your district does will affect the study on another district. So you kind of have to look at it that way. Oh, I did. I don't read it. On the slide, here are some of the direct service activities that are appropriate. If you have individuals who are providing services as described in the student's IEP, documenting session notes, developing material to be used for future sessions, reviewing or monitoring the student's health plan. All of these are valid things that your staff members should be doing at least a part of their day. Not all day, but at least a part of their day. They need to be doing that on any typical day. These people, these staff members have been identified and they are providing these services as outlined in the handbook in Section 3. Remember that your LEA can only submit direct services for interim payments if these staff members are appropriately credentialed and in the right areas. Administrative activities. This is one that can be a little more difficult because you do have different people on here. It's not as easy to do as plugging in your OTs, your PTs, and your speech people, because we know what they do on a typical day. But when you start throwing in your administrative people, you have to look at, are they doing Medicaid outreach? Are they facilitating a Medicaid enrollment? Are they helping the parent complete an application for Medicaid? Are they arranging transportation for a Medicaid eligible student? Are they arranging for interpretation? Maybe you're getting ready to have your IEP meeting and you need an interpreter or a translator. If your staff people are doing that type of service, then that would constitute a billable moment if they responded correctly that way. If they're doing program planning, policy development, interagency coordination, providing or receiving training materials, related to the delivery of a Medicaid service. And finally, referral, coordination, and monitoring of the Medicaid services. These are all tasks that your administrative staff pool should be doing on a typical day, on any typical day, in order to be in that staff pool list. Now, we know that they're not going to be working with a student all day, or they're not going to be doing other things all day. There are certain activities that do constitute a valid response. You're monitoring the lunchroom for your kids. That would be a valid response. You're in a fire drill. That would be a valid response. The parent calls in and they're asking questions about an upcoming field trip, and you're giving a response to that parent at that time. You're eating lunch in your car, but you're not being paid for it. If you put that in your moment, then we can properly code that. I love this one. People will say, I was in the bathroom. Hey, that's okay if that's what you're doing at the time of your moment. I don't need complete details on what you're doing, but you know, you can say, I'm on a break. But all of your participants should respond accurately and tell us what they're doing. That way we don't have to go back out with a follow-up question. You know, if they can be as complete in their first go around, it makes a big difference. All right, and now we're going to switch to Ms. Devon again.
Hello again. So how can you use your cost pool lists to your advantage? So it is possible to have someone who is properly credentialed within Section 3 of the handbook. So you might want to put them in the direct services cost pool list, but maybe it makes more sense to put them in admin because the activities that they support are more what you saw on the last slide. So maybe they are a licensed SLP, but what they're doing is not directly providing services to the student, but they're arranging for those services, or they are monitoring the progress through the IEP, those kinds of activities. Next slide. So this slide should hopefully be helpful in deciding where to put a staff person in your cost pool lists. The very first question you can ask yourself is, will this staff person provide direct services to students? If it's yes, they're in Section 3, they're properly credentialed, put them in the direct service cost pool list. That's the easiest thing you can start with. If the answer is no, then you have more questions to ask yourself. So will this person support the administration of these services? Yes, we can evaluate for the admin cost pool. No, you're going to be hurting percentages by including them in. So you may be able to claim their costs later, but you're actually going to be hurting the percentages that affect overall reimbursement. Next slide. So here's another similar slide where you can see the balance. If you've got a teacher inappropriately in the administrative cost pool list, they're never supporting an MA service. So they're never going to be getting, they're never going to be coded as helping our percentages. Everything's going to hurt. But if you've got someone in the administrative cost pool list who does support MA administrative activities, they could be at the time of their moment helping, or they could not be, but you have a much higher chance of helping percentages by having that person on the cost pool list. Next slide. Oh, back to you again.
So some key points to remember. I know we've given you a lot of information, but circling back to some key points from today's RMTS presentation, the integrity of the RMTS is vital. Inaccurate staff pool lists or non-compliance in responding to moments directly affects reimbursement amounts. LEAs can and should regularly update their staff pool list to reflect staffing changes, ensuring that the RMTS captures current operational realities. SSG also provides training for staff who respond to the RMTS moments. We do participant trainings often before each quarter. So please, if you don't have an opportunity to get with your staff and do that training at your LEA, please connect them with one of the SSG trainings. The training yearly calendar is out there. It's on the landing page for the SBAP program in the SSG system for eCivic Max. So please connect them with a training so that they understand what the SBAP program is about, why they're being selected, and the kind of information that they are responding to. This helps ensure that the data collected is reliable and valid. It is important that these folks understand their responsibility. It's all a shared responsibility in the SBAP program. Everybody has their part. So it's vital that participants as well understand their part. By meticulously managing RMTS cost pools and adhering to the prescribed processes, LEAs can accurately determine the claim costs associated with Medicaid-eligible services provided in your schools. Okay. So, reminders. What percentage of a staff member's salary is paid outside of what I used to consider general district funds? Please remember that these funds need to be offset when you are reporting your costs. And this is outlined in Section 7B of the new 2023 CMS guidance. If a time study participant's salary is wholly funded by third-party dollars, such as federal grants or private foundations, the staff person cannot be included in the time study sample, either cost pool. So if they're 100% funded by other, state or federal dollars, they should not be on your staff pool list. When those third-party dollars only partially cover the salary, the staff person can be included in the time study. However, the portion of the salary paid by the third-party source must be offset when costs are allocated for both MAC and your cost settlement. So on behalf of Devin Hogan, Becky Stoddard, and myself, Paula Schmidt, I'd like to thank you for participating in this portion of today's training. Should you have any policy questions, those types of questions regarding policy should be directed to the DHS resource account that's listed on your screen, the RAPWSBAP at pa.gov. System questions, something that might not be working correctly with the system, that may happen from time to time. You're going to want to send those system questions to SSG's support team at the PA support@civicsolutionsgroup.com email. For folks that are attending this session virtually, please remember to let us know your thoughts about this portion of today's training by clicking on the survey link provided. This link is also going to be made available by clicking on today's training presentation for you folks that are here in the room. If you click on today's slides that you've been given, you can click on that link as well. And I think that concludes this portion of today's training. So I think we'll have some question and answer time.